Hi, this is Jennifer Allen reporting for RSNA News. I'm talking with Dr. Andrew Kolarich, an interventional and diagnostic first-year radiologist at Johns Hopkins Hospital in Baltimore. We're talking today about his experiences on his hospital's COVID-19 unit. Thank you, Dr. Kolarich, for joining me.
Thanks for having me, Jennifer.
So first, before the COVID-19 pandemic began, what were you planning on doing and what are you doing now?
Sure. So before the pandemic, which seems like a long time ago, I was planning on going to the Society of Interventional Radiology conference in Seattle with a lot of our co-residents. Obviously, that was canceled and virtual, but that was a little disappointing. I was planning on going on a nice vacation with my wife. We had to cancel that, obviously. And in terms of my radiology training, I was starting my musculoskeletal radiology rotation and my neuroradiology rotations.
So what kind of work were you asked to do on the COVID-19 units at your hospital?
I was basically functioning like a first or second year internal medicine resident. So I started on nights in our downtown hospital, Johns Hopkins Hospital. We had a lot of patients transferring who needed increased levels of care from our community hospitals. So I basically put in admission orders, made sure things were lined up for our nurses and respiratory techs, performed some procedures. And then during the day, I did exactly what an internal medicine resident would do during their normal ICU time. I rounded on patients, made sure everything was set up properly. And then another big part of what I did was make sure each family was given a call with an update every day.
So I would imagine that was probably the hardest part of what you were doing on the COVID-19 units, was speaking with the families who couldn't be with their loved ones.
Yeah, I mean, it was a big change for me to go into that unit. I spent a year as a Halstead surgery resident at the hospital, and so I knew the hospital pretty well. I had a lot of friends in the hospital. I knew how to admit patients and take care of very sick patients, but I had never seen so many patients who needed mechanical ventilation for so long. It was really surprising. And of course, because of coronavirus, their families couldn't visit them. And so trying to paint a picture of what was accurately happening to families, be accurate and kind of set expectations, and then arrange end of life issues and arrange things for families who often were totally caught off guard by a lot of this for some people was definitely challenging. And I'm sure those conversations are going to go on long after coronavirus and before coronavirus as part of medicine, but this definitely put a lot more strain, I think, on the system than we were used to.
What was surprising or unexpected about your work on the COVID unit?
You know, I think the hardest part about going to the COVID unit initially was trying to get a sense of what the real risk was. I spent a year as a surgery resident, but there were so many things that had changed even in such a short amount of time. We were making sure that all of our imaging for our patients, for example, were bundled. We wanted to expose our radiology techs to as little patient room or patient contact as they could, our nurses. So everything became bundled. If I had to transport a patient across the hospital 6 months ago, not terribly difficult. Now it was a whole production. To get a family in was a whole production. And so just navigating that and also trying to navigate the fact that I was probably at an increased risk of exposure, certainly, and I didn't want to bring that back to my family was really important. But once I got there, the cool thing was we had residents coming in from all specialties. I had a plastic surgery attending who was my co-resident putting in orders, and I was showing him how to put in orders. And so it was really cool. We had nurses from radiology. We had nurses from the pediatric floors. It was really surprising, and I think probably a once-in-a-lifetime sort of event.
Absolutely. It sounds like your experience is very similar to a lot of other residents as a quote unquote once in a lifetime type experience. In regards to your training, how do you think that the COVID-19 pandemic will affect long-term radiology trainees education?
That's a really good question. And I was talking to some of my friends about this in our program. Definitely had a major impact for about a month a month and a half. We're already seeing our volumes pick up. I was on neuroradiology today. We had a decent number of strokes. We had a decent number of tumor workup. People are going to their elective surgeries now increasingly. And so long term, I don't think it's going to have huge impacts, at least at Hopkins, from what I can tell right now. The biggest thing for me, and I was talking to my friends about it, as a first-year radiology resident, we have people with a ton of experience who are attending, who've been practicing for 15, 20, 30 years. And now we're trying to sign out studies with them virtually, and it's challenging. And so those people have such great clinical expertise. It's really nice to be able to sit down in a room one-on-one and work through a study with them. But at the same time, I don't want to, as a 26-year-old, expose them to coronavirus. So working through that may take a long time, and we're going to have to be creative about it.
Well, thank you, Dr. Kolarich, for your time today. For more information on RSNA's coronavirus COVID-19 resources, please visit rsna.org/COVID-19. And always, for the latest radiology news, visit rsna.org/news.